Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Government calls for attitudinal change among residents to curb the spread of COVID-19. Muslim leaders in Ekiti state back out of planned reopening of religious activities in the state over inability to meet up with safety guidelines set by the government. Across the world, cities and states on several continents reimpose restrictions as coronavirus cases surge again. Now, more than 305,000 people have recovered from the coronavirus in several countries across Africa, while over 609,000 cases are confirmed on the continent with 13,000 deaths. A summary from the West African region shows Nigeria leading with 33,153 confirmed cases from the ECOWAS Information Board. Ghana is in second place, while Côte d'Ivoire is in third place, as you can see on your screen there. According to the Nigeria Center for Disease Control, NCDC, 4 deaths were recorded in the last 24 hours in 4 states. That's Edo, Lagos, the FCT, and Osun State. In the meantime, 224 cases were discharged in the last 24 hours in 13 states, 73 in Rivers, 40 in Edo, the FCT 20, 19 Lagos, Plateau 16 cases, Adamawa 12, Akwa Ibom 12, Kaduna 11, 7 each in Kebbi and Ogun State. Imo recorded 4 recoveries, Kano 2 recoveries, and 1 in Gombe State. Now to Lagos State, the epicenter of the pandemic in Nigeria, where the Lagos State Governor, Mr. Babajide Sanwo-Olu, has responded to the grievances of the striking doctors of the medical guild in the state. According to the governor, the doctors' hazard allowances have been paid and increased by 400%, and the state government is in the process of recruiting about 760 health workers so as to reduce the burden on them. Governor Sanwo-Olu asked the health workers to call off their strike, assuring them that all pending issues will be resolved. The Lagos doctors employed by the Lagos State government embarked on a 3-day warning strike, which started yesterday with demands over welfare.
Our government was the very first government in March that started paying hazard allowance to our entire health workers. Almost 20,000 of them. And what did we do? For the hazard allowance, we increased the hazard allowance by 400%. The COVID allowance, we needed to do proper enumeration. We needed to be sure that the people that were going to be paying the COVID allowance to were people that had worked during this COVID period and had worked in one or all of our isolation centers. Right. So we had a 2-month delay, meaning that we paid 2 months, then we had not paid May and June. As I speak this morning, all of them, most of them, if not all of them, have got the allowance for the 2 months arrears. I gave the approval since last week. NIMS is, I'm sorry to mention their name, NIMS is an international name. There was some glitch over the weekend. They were informed that these things were coming on Friday. There was a glitch in the system. It's transfer. Everybody today, you don't write a check for anyone. It's supposed to be an online transfer. I've given approval to recruit 760 health workers, of which 400 are doctors alone. Even the capacity to be able to identify the 400 doctors is also a challenge. And that process has started. They know. I think it's rather unfortunate. And I think it's totally condemnable. And I think I hold the system, as a chief incident commander, to express and to say to you that come back to work. I'm still your governor. Resume back to work. Whatever the issues are, we'll sort it out.
Let's take a look at the Channels Television COVID-19 data monitoring dashboard with all of the national figures that are coming in. You can see Nigeria there with all of the states, and of course the red portions telling us where the virus is concentrated. The confirmed cases stand at 33,153. Of course, that total is the addition of, sadly, those that we've lost, those that have recovered. Of course, active cases we're managing at the different treatment centers across the country. We have at 18,738. The interesting thing about the Channels Television data monitoring dashboard is it breaks down some of the local government areas of the 36 states and, of course, the Federal Capital Territory. And a list here takes you through all of the states. And of course, you know that the top 5 states are Lagos, the Federal Capital Territory. We have Oyo State in 3rd place. There is Edo, there's Rivers, but of course, in terms of regional interpretation, we have a number of states that are topping that region. So let's focus, let's take a closer look on one of the states, and that is Ogun State. It's flanked by neighboring states like Ondo, Oyo, and Osun states. And then, of course, you have by its south, you have Lagos, and there is, of course, the Atlantic Ocean, and in the west by the Republic of Benin. Ogun is strategic because it also makes an access route to the expansive markets of the Economic Community of West African States, ECOWAS. And we know that Abeokuta, of course, you can see there in red with a few cases of COVID-19 as well, is about 90 kilometers from Lagos State. And then from the Federal Capital Territory, Abuja, we have about 740 kilometers, Ogun State, where it is strategically located. We have a number of councils affected, 19 out of its 20 with cases. And by the time you look at it, we have Ado-Adota, where it appears the virus is concentrated with the number of cases there at 496. We're also seeing that this is also a state that, or rather data coming in as at July the 12th, and this is from the government. The state has discharged 736, made 736 recoveries, and sadly it has lost 22 persons to the virus. In terms of the number of specimens collected, sample testing, it is testing as at July the 12th stands at 4,780. There's several several things going on with the state with regards to measures that the state government is putting in place, indeed, to curb the spread of the pandemic. But essentially, these are a few of the figures in terms of the local government areas. If you take a look, for example, at Ikenne, it tells you what indeed is happening there, and that we have about 46. But more people want to know indeed why we're still having this large spread, and perhaps if it is community transmission that is ongoing, and indeed if any of the local government areas in Ogun State are one of the high burden that the PTF has indeed talked about. But restrictions still there exist, but there is something the state government is doing now, and it is calling for an attitudinal change among members of the public in the state, and this is to reduce the spread of the pandemic. The State Commissioner for Health, Dr. Tomi Koka, gave the charge while also explaining the factors responsible for the higher figures that were recorded in 2 main local government areas in the state since the virus was first detected.
The fight against coronavirus in Ogun State is one campaign the state government says it's taking seriously with a determination to flatten the curve. Isolation centers and molecular testing centers have been established in 3 senatorial districts. Despite this and other measures put in place, 2 local governments, Ado-Adota and Shagamu local government, have recorded 496 and 265 cases respectively. The virus spikes in the 2 local governments have been attributed to community transmission.
There's still need for more orientation and for our people to cooperate with the government in the area of complying with the guidelines.
Compliance to safety practices like social distancing, wearing of masks, among other precautionary steps, are still being flouted by the residents. But the government says it is intensifying prevention advocacy.
We have to ensure that you protect yourself and you protect your neighbor. Once we take personal responsibility, then we have a better chance of actually conquering this coronavirus and hopefully sometime in the future eliminate it from our society.
With close proximity to Lagos State, the epicenter of the coronavirus pandemic, the authorities in Ogun State say they are taking the gospel of staying safe and taking responsibility to all the residents of the state.
Looking at more ways to flattening the curve, Dr. Hassan Souley from the Department of Public Health, National Open University of Nigeria, joins us from our Abuja studios. We'd like to thank you for joining us on the program.
Yeah, thank you very much.
All right, let's first look at community transmission stage we appear to be experiencing around the country. There have been several projections that the virus is yet to peak, and awareness has been said to be a major issue to the fight. But why do you think we still have that problem with people being aware of what COVID-19 is, the risks, and how indeed they can protect themselves?
Yeah, thank you for having me again. The messaging concerning with regards to COVID-19 has been at best mixed. Right from the very beginnings of it, it seemed like we weren't clear what exactly it was and how it is transmitted. At first, there were messages like it was airborne, and then there was times they said it was droplet infections, and now we're back to the stage where they say it's airborne, and then face masks need to be used by people. So a mixed messaging has characterized our approach to COVID-19. But as to why community transmission remains high, I think that's because apart from the easy transmissibility of the virus, we have a situation where people have to take care of their economics and have to take care of their homes. The best scenario would have been government coming in to support each and every household, but failing that, there is nothing you can really do reasonably to stop people from going into places where they're likely to come into contact with these viruses. I think that would rank among one of the major reasons why community transmission remains high. But the silver lining is that going by the pathology of this virus, up to 95% of people who come in contact with the virus would get well, will have the virus and get well without even knowing they've contracted it. So on the upside, as time goes by, there is a positive build-up of immunity in our society. But then again, the fear is that in the chain of transmission, the virus could come into vulnerable people who unfortunately would tend to lose
their lives, being at high risk to them. But one of the priority areas to contain, and this is community transmission, we hear, is the points of entry. Take, for example, in the southwest, you have Lagos State as the epicenter in Nigeria, and then bordering, you have Oyo, Ogun, Ondo. These states are also in the top 10 highest cases that we have in the country. And restrictions in those states are not quite uniform. Do you think there is enough state ownership and perhaps even more state collaboration in this pandemic fight?
From the increasing numbers of community transmission, you'd be forgiven if you said there's not enough being done. But again, it is humans that transmit the virus, and human behavior is key. Now, for a society that is not wealthy enough to support households and then thereby tell people to stay indoors, I mean, you run the risk of having a spread like this. Lagos is the commercial center, arguably the commercial center, commercial hub of Africa. So naturally, the surrounding states would feed into Lagos for sustenance, and the running around to make ends meet, it's natural that the virus will spread to surrounding states more easily. But what would states have done? That's tricky. This, first of all, the virus caught us unawares worldwide, and we didn't get to know. Some people say the COVID virus would have been in circulation from around October last year. So we didn't get to know that. So it's possible that this virus would have been transmitted longer than when we realized it at the end of March on our shores. That again is a problem. So what would governments have done? For a case like ours, the best bet I think would have been to continually message people, plead with them, appeal to their better judgments or to the nobler instincts within them, and ask them to stay, because when they stay, there is chance. I mean, we have a greater chance of fighting the spread of the virus.
We appreciate your time. Thank you so much, Dr. Hassan Souley from the Department of Public Health, National Open University, Abuja. Thank you for joining us at this time. We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. Muslims in Ekiti State are backing out of the planned resumption of religious activities. They are citing conditions, talking about set by the state government before public worship can take off. In the meantime, Christians are, however, forging ahead, trying to negotiate the deal and secure some concessions with government. Here's our correspondent, Babajide Agbeyo, who brings us this update.
As announced by the governor of Ekiti State, Dr. Kade Fayemi, some weeks ago, religious activities will be resuming this weekend in the state. However, Muslims in the state have come out to say they are suspending their own resumption for now. Their leaders met over this and they came out with a position that the conditions set for it, they don't want to pretend they can meet those conditions, and for now, they will be praying at home. But for Christians, they are set to resume. But there are still some issues around this. The first issue is the rumor making the rounds that the state government is trying to levy churches for fumigation, exercise, and certification. But the State Ministry of Environment has come out to debunk this. The ministry has stated clearly that religious centers have been told that they are to carry out the exercise by themselves, as the ministry will only supervise and certify, and this will be at no cost.
I want to see it as hearsay, yes, because and that had warranted our giving a press release on this, for people to know that government is not charging anything. All that you are doing, all the services that are going to be rendered should be seen as service to humanity. And we have stressed this so many times at our meetings, at our gatherings with the religious leaders, for them to know that government, in whatever form, will not be charging anything.
In the meantime, community testing is in progress in the state across the 16 local government areas. 4 local governments have been covered so far. These are Ikere, Iselrun, Emure, and Bonyi local government areas. And 14 new cases have been discovered in that process. The State Ministry of Health has again advised people not to let down their guards at this time, as the war against COVID-19 is not yet over. Babajide Agbeyo for COVID-19 update.
Healthcare facilities should prepare for large increases in the number of COVID-19 cases, as well as people presenting with similar symptoms. According to the World Health Organization, staff should consider COVID-19 for any patient presenting with respiratory illness. They should be prepared to recognize signs, symptoms of known complications and administer appropriate care. Medical laboratory scientist, medical virologist, Mr. Solomon Cholam, he joins us via Skype, tracking the virus spread. We'd like to thank you for joining us at this time. I'd like to begin by asking, how would you assess the surveillance strategies to actively monitor the disease trends and its impact?
Yeah, so thank you for joining me.
the emphasis has actually been on testing, and so surveillance is, to get a very clear case definition as far as the symptoms of the virus, are concerned. You understand that when we started, we were looking at issues with history of travel, issues that has to do with the presentation of signs like coughing, fever, and all of that. But the case definition has been upgraded to also capture issues of loss of taste, issues of loss of sense, smell, and all of that. So when the right case definition is, implemented, we will be able to have more likely cases, brought into the testing net. And that in itself is going to, help us to detect as many as are carrying this virus and enhance our efforts in treatment of the confirmed cases.
So in terms of the major trends on the virus spread, how do they impact the efforts that we're making? And this is the efforts across board.
Yeah, so I listened to your opening gambit, and you seem to be talking about the concentration of the virus, in the southwest around Lagos. And if you look at the dashboard of the NCDC, you will also see that we have, a high rate of infection in FCT, and all of that. So these are no doubt linked to, issues around international travels. That's where we have a lot of people coming into the country as at the time that our borders were not, closed. So that contributed a whole lot to the fact that we are having community transmission already in those places. So boiling down to issues of testing, what we need to also do is to look critically at the platforms that we are using now. Is it sustainable? Is the current effort around molecular testing going to serve us, or we need to look deeper to have issues of rapid diagnostic test kit to be able to do massive community testing, then have a preliminary outcome, after which the ones that give clue to positivity can now be subjected to molecular testing.
All right, we appreciate your time. Solomon Chola, medical laboratory scientist, medical virologist. Thank you for joining us on the program.
Thank you so much.
Many countries and cities around the world are returning COVID-19 restrictions as cases rise globally. From Morocco in Africa to Asia, leaders are realizing they still need to do more to prevent spiraling deaths and spike in cases. Here's more on our global update.
About the COVID issue. I just listened to a call
in the United Kingdom, following Prime Minister Boris Johnson's advice that citizens wear masks in confined spaces, Health Minister Matt Hancock announced in Parliament the compulsory use of face masks in shops.
We've therefore come to the decision that face coverings should be mandatory in shops and supermarkets. Last month, we made face coverings mandatory on public transport and in NHS settings. This has been successful in giving people more confidence to go on public transport and to a hospital setting when they need to.
France celebrates a modified but sealed day today because of the coronavirus. The President, Emmanuel Macron, in a rare television interview, said he would like to see face masks mandatory in all public enclosed spaces and that this could come into effect on August the 1st. Australia has tightened restriction movement as authorities struggle to contain a fresh outbreak of COVID-19 in the country's southeast that has pushed the national tally of cases beyond 10,000. The changes come as scores of new cases were uncovered in Victoria, the country's COVID-19 hotspot, despite a return to lockdown last week for nearly 5 million people in the state of Melbourne. Over in the United States, California Governor Gavin Newsom's decision on Monday to reimpose restrictions on bars, restaurants, gyms, and even ordinary office work to tamp down a surge of coronavirus infections is dimming economic growth prospects for the nation as a whole.
From the NCDC, evidence on airborne transmission of COVID-19 reinforces the need for strict adherence to preventive measures such as avoidance of mass gatherings, the use of face masks. As it continues to adapt the guidelines as scientific evidence emerges, you can take a closer look at the website with the updates on the regulations and guidelines to the pandemic. Also from the World Health Organization, a live feed of the website has regular updates, strategy guiding the public health response at national and subnational levels. Our website, channelstv.com, has the latest news. You can find stories there coming in from Nigeria, Africa, and the rest of the world at your fingertips. channelstv.com. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.